Good morning, everyone, and welcome to my presentation. Now I'm going to present our research with the purpose to investigate the effects of respiratory therapy on pulmonary function in patients with cerebral palsy. My name is Erika Kolumbán. I am a conductor-teacher working at Semmelweis University András Pető faculty, and our research was carried out with the support of Ibolya Túri, Mark Hernát-Fői, Dániel Veresek, Ádám Zolcsák. As a conductor-teacher, my vision is to improve the quality of life of children with cerebral palsy through better rehabilitation and to contribute, of course, as a conductor to the world recognition of the conductive education. My mission is to improve the condition of our patients' children by applying evidence-based breathing exercise series in their rehabilitation care. And today I'm going to present to you how I'm going to accomplish this mission. In order to achieve this mission, we set two specific goals. The first one is a meta-analysis where we investigate the benefits of the supplementary respiratory therapies on pulmonary function in pediatric population. And the second one is also linked to the first one, investigates the effects of the Hungarian conductive breathing exercises on the pulmonary function in case of school-age children with cerebral palsy. Let me introduce to you our first project and to give you a few information to the background. So the cerebral palsy is still one of the most common disability among the children, and it affects not just the neuromuscular system but also the respiratory system too, and unfortunately today is still the leading cause of death among this population. However, the newest consensus statement advises us professionals to perform regular preventive exercises and moreover assessment regarding this issue. If a child is diagnosed with cerebral palsy, receives conventional therapy, which means physiotherapy or neurodevelopment approach or conductive education. This therapy concentrates mostly on the motor development and unfortunately does not include the respiratory therapy, which could be performed with the help of a device, manual techniques or breathing exercise series performed in a playful manner. So we aim to investigate the benefits of this different kind of respiratory therapies. And the question was, does this kind of different therapies will improve the pulmonary function compared to the conventional therapy alone? In order to receive an answer, we compared the conventional therapies added respiratory therapy with conventional therapy alone, and we looked for measurable changes in pulmonary function, respiratory muscle strength, and quality of life. And we hypothesized that if we use these therapies among the conventional one, we will find better improvements in the pulmonary functions in generally. Last year, we conducted a systematic research in 5 major databases, and at the end of our selection process, we identified 12 eligible randomized controlled trials studies. And now I would like to present a few results of our analysis. One of the important value, it's the peak expiratory flow, which measures the maximal amount of air which a person can exhale. And I choose to present the results of these values because in case of pediatric population with cerebral palsy, it's very important, could be important because it's objective, it's easy to perform, and it's not depends on the abilities of the performer. you can see two forest plots because this value measured with the spirometer can be expressed in percentage and also in liter. And on the right side of the forest plots, you will see the studies who favors to the intervention groups, and on the left side, which favors to the control group. Among moderate heterogeneity and relative small number of studies, we find a clinical meaningful change in this value, which tell us that if we use additional therapies, then this value will increase in our patients. Another important value is the respiratory muscle strength expressed in maximal inspiratory pressure and expiratory pressure measured in water centimeter. And among high heterogeneity caused by different therapies and different population, we still find that the interventions favors to the intervention group. The third result is the quality of life after the intervention. Unfortunately, we couldn't conduct a meta-analysis due to the lack of the data, but it's still promising the systematic search, which says that, for example, bodily pain can be reduced by adding respiratory therapy to the rehabilitation. So our strength is that we included only randomized control trial. We were able to identify the sources of the heterogeneity. We followed a very rigorous methodology, identifying overlapping populations and mathematical errors in other meta-analyses. The complex calculation includes not just after values, but also estimated change and multivariate analysis. And of course, we are aware of several limitations that the most important results regarding the quality of life, it's limited. And we also found a relative small sample size. But we can say that in conclusion, that if we add this kind of respiratory therapies to the conventional rehabilitation, that will be to the benefit of our population, and the practice should incorporate in their daily praxis. And for the research, our message is to conduct further investigation, especially regarding to quality of life. So here you can see the status of my manuscript, and I am awaiting the response from the journal. And I would like to move on the second project and to present to you a few background information to the conductive education system. This novel and game changer system, it fundamentally changed the rehabilitation world after 50s, not just in Hungary, but also worldwide. And I strongly believe that not just because the complexity of this rehabilitation care, but also because it includes already the breathing exercise. It's a part of the rehabilitation system. But unfortunately, we don't have a clear protocol. There were no research done on the subject, and there is a need to design a new protocol in this. And our aim is to design, firstly, the protocolized conductive breathing exercises and compared with no breathing exercises or the non-protocolized one. And we are searching for measurable changes, not just in the pulmonary function, but also in the muscle tone and anxiety, for example. And we strongly believe that we hypothesize that we will find improvements in these functions. So at first, as a first step, we analyzed the old manuscripts authored by András Pető, more than 8,000 pages like this was analyzed, and we find keywords like this regarding to the breathing and diagnosis and methodology. And we identified more than 600 exhalation breathing techniques, for example, exhalation with vocalization or deep breathings technique and so on. Just shortly, you can see another cluster of our results proposes how to perform the breathing, motivational exercises, and also strict advices regarding to the length and duration. And we find also a clear protocol regarding to the ventilation and Pető's proposals, also matching with the proposal of the Hungarian National Center for Public Health, and it's tell us that also this original idea from András Pető, it's strong, and it's based on a knowledge which can help us to design a good protocol, and after that to conduct a randomized control trial to see which results we will find. And this is my plan for the next months to finish my second project. So thank you for your attention. Winston Churchill said, success is going from failure to failure without losing enthusiasm.
Thank you for your presentation. You said that you collected data about the respiratory parameters as well, and you said that the heterogeneity was quite high because of the different techniques. And what are these techniques, what they used? Thank you.
Thank you for your questions. Maybe you can remember on the very first slides, there are different kind of respiratory therapies, and we identified as a single entity also a manual technique or also a device like incentive spirometer, but also a breathing exercise series.
I was wondering, can you measure maybe the benefit of the added respiratory exercises for the general motor function focused exercises? So is there like an interaction effect? So doing extra respiratory work, it helps other exercises?
Of course, there is also data about if you perform aerobic exercises alone, that performing motor exercises, you will also have a better respiratory status. But in case of our populations who are sedentary in the wheelchair or moving less than us, there is needed an extra attention and extra exercises to have a better respiratory status as us, as the healthy peers.